We often take breathing for granted, doing it without ever having to think about it. But for those with underlying lung conditions, it's not such a simple process. And I think the COVID-19 pandemic has given those people without any previous lung concerns a new appreciation for how important it is to keep our lungs healthy. And there are a number of risk factors for developing lung disease, but also ways to prevent it. Number one on that list is smoking. We know that smoking causes lung disease by damaging the airways and the alveoli, and those are the little air sacs within our lungs. It's the most common cause of lung cancer, but secondhand smoke is also a concern. So people who regularly breathe in secondhand smoke are more likely to get the same diseases as smokers. And it can particularly affect children who are then at higher risk of developing asthma and allergies. But quitting smoking can reverse some of that lung damage and reduce the risk of developing cancer. But it's undeniably difficult to quit smoking because of the addictive nature of the nicotine within cigarettes. But there's help out there. For example, the NHS Stop Smoking services offer professional advisors, treatments and support groups. So do seek help if you need it. The second point is with regards to pollution. Research shows that long-term exposure to pollution can increase your risk of lung disease and that it might also contribute to lung cancer. But also, if you're already a sufferer of lung disease like asthma or COPD, it can precipitate a flare or an attack. Now, ultimately, ideally, we want to reduce the pollution, and I think that's more of a wider issue, a political issue. But in the interim, you can follow the air pollution forecasts, which give you an indication of when air pollution is particularly bad. And on those days, you may want to limit your time spent outdoors. It might also be really useful to avoid exercising outdoors next to high traffic areas. My third point is with regards to exercise. We know that aerobic exercise and exercise in general can just help improve our general health, but including that of our lungs. But there's also specific breathing exercises that you can do in the comfort of your own home, which are aimed at specifically improving your lung health and your lung capacity. Now, one of these is called diaphragmatic or belly breathing, and that's where you engage your abdominal muscles and your diaphragm when you're breathing to try and actively pull down that diaphragm when you take a deep breath in. And that then increases your lung capacity and fills your lungs even more efficiently. The other form of exercise is called pursed lip breathing, and that's when you exhale through pursed lips in a slower, more intentional way with the aim of helping you control your ventilation and your oxygenation. My fourth point is about vaccinations. Now, one of the best ways we have to prevent the spread of certain diseases is through vaccination programs, and vaccinations stimulate your immune system to produce antibodies so that when your body is put up against that virus or that bacteria or infection, it knows how to fight it without having had to have the disease first. Now, currently we have vaccinations for respiratory conditions like COVID-19, influenza, pneumonia, TB, and pertussis. So if you are offered a vaccination, I really would recommend that you take it. It's always better to prevent disease before it starts rather than just try and treat and cure. My fifth and final point is about knowing when to see your doctor. Now, most respiratory illnesses like coughs and colds are self-limiting. You can manage them at home with, self-help things like rest, fluids, over-the-counter medications, pop down to your pharmacy, they can give you suggestions. But there are some cases in which you do need to see your doctor. So if you have had that cough for more than 3 weeks, or you're finding it hard to breathe, your cough is particularly bad or quickly getting worse, if you're coughing up blood or you're feeling very unwell, if you have any chest pain or losing weight for no reason, these are all reasons to see your doctor. Furthermore, you might need to see your doctor a bit sooner if you have a weakened immune system and know that a simple cough could escalate more quickly. Now, whilst most coughs are caused by viruses like cold and flu and nothing to worry about, some can be caused by other things like bacterial infections that may need antibiotics, allergies, postnasal drip, acid reflux, smoking, and in some rare cases also cancer. So it is important to see your doctor if you have any concerns.